Hello everyone, I'm back with today's video on the topic of case taking in acute diseases. This video will be helpful for all first to fourth year BHMS students in framing the long answer question as well as having detailed knowledge about what is acute diseases, definition of acute diseases, the important aspects of acute diseases and how a case is processed in acute diseases. So let's begin with today's video.
So first we'll study about acute cases. As I already said, acute cases are caused either by exciting cause or acute miasm. Acute cases are defined as diseases which begin suddenly, progress faster, run a definite course and end either in recovery or death. While attending an acute case, the physician should limit his inquiry to the recent deviation from health. Obviously, acute cases के लिए ailments from is very important. किस वजह से acute disease आया is very important, and also modalities are very important. One should not waste time in collecting details of constitutional state, as acute cases require immediate medical intervention. Now what is important are the two aspects which has to be taken in acute case. First is the presenting complaint, जो हम L, S, M, C ये चारों के फॉर्मेट में लेंगे. लोकेशन, सेंसेशन, मोडालिटी एंड कॉन्कॉमिटेंट. सेकेंड इज़ द जनरल, जिसमें फिजिकल और जनरल दोनों आता है. फिजिकल्स में अपना एपेटाइट, थर्स्ट, थर्मल रिएक्शन, रेस्पिरेशन वगैरह वगैरह सारी चीज़ें. एंड देन कम्स द मेंटल, जिसमें हम मेंटल चेंजेस पे ध्यान देंगे कि इरिटेबिलिटी है या कन्फ्यूजन, फियर, रेस्टलेसनेस, ऐसी कोई मेंटल सिम्टम है क्या. नाउ दीज विल फॉर्म the basis of treatment of acute diseases. Treatment of acute disease is much easier by the homeopathic mode of treatment because the manifestation and picture, they both remain clear to the physician as well as the patient both. Therefore, difficulties in forming a totality and selecting a remedy are minimized. Moving further, how to do the case processing of acute diseases. फर्स्ट स्टेप इज़ डिजीज़ डायग्नोसिस. बहुत लोगों को लगता है कि ऑब्वियसली मिसकंसेप्शन है कि होम्योपैथी को डायग्नोसिस या लैब इन्वेस्टिगेशन से क्या लेना देना है, बट इट इज़ नॉट दैट वे. होम्योपैथी हैज़ टू डू विथ डायग्नोसिस. डायग्नोसिस की हेल्प से वी कैन नो कि भाई कौन सा टिश्यू, सिस्टम या ऑर्गन अफेक्टेड है. वी कैन नो द टाइप ऑफ डिजीज़, आइदर इट इज़ इंडिविजुअल, स्पोरैडिक और एपिडेमिक. We can know the pathology and its extent. We can know the prognosis of disease and prophylactic measures as well. So disease diagnosis is very important for the first step of acute diseases. Second comes the diagnosis of phase of disease. Since acute diseases require immediate medical attention as they are intense, sudden, sharp and with unpredictable conditions. Therefore, phase of diseases should also be known for an acute disease. Third comes the diagnosis of miasm, diagnosis of dominant miasm for the acute case. Fourth is the diagnosis of susceptibility of the case, either it low or medium or high, so that posology can be decided. Fifth is erecting an acute totality. Acute totality हमें बनाना है in this format. First is ailments from. Ailments from will be the exciting cause. अगर हमें ये मिल गया तो it is very good. Then comes the location, sensation.
So this was all about case taking in acute diseases. This video will be helpful if you want to frame the long answer. And stay tuned for another video on case taking in chronic cases. Thank you.